Hi, everybody. Welcome to week 7. You have made it to the halfway point. So, that is something worth celebrating. So, you're halfway through the course. As you can see outside my window, it is a beautiful sunny day. So, I'm going to take that as a positive sign as well. So I hope you're all doing well. Please keep me posted if you have any questions. I'm here to make sure you understand the material, so please let me know if you need anything. So this week there is, as usual, as you've come to expect, quite a bit of information. We talk about hepatitis, pancreatitis, diverticulitis. There's a lot of itises. We talk about what else is in there? Irritable bowel syndrome, inflammatory bowel disease, a lot of stuff. So take your time going through it. So I just kind of wanted to go over how to discuss GI issues with your patients. So as you can imagine, it's not really good dinner conversation to talk about bowels. I know as nurses, we do this all the time anyways. It means nothing to us to ask somebody, did they have a bowel movement today? I work in long-term care. I understand that they always want to know when the last bowel movement was. But when it comes to, talking with a patient who has no medical background, maybe, it could be a little embarrassing for them to have you ask questions about their poop. Or are they having a lot of nausea and vomiting? Or are they bloated, gassy, crampy? You know, what are their symptoms? And it's important information for you as their provider to understand their condition, especially maybe they have underlying ulcerative colitis or Crohn's, and you're trying to, determine whether or not they're having an exacerbation, or they have a history of a liver disease, and you're trying, are their stools clay colored, and you're trying to figure out, are they having an exacerbation of something? So just to kind of remember to put yourself in the patient's shoes and have a little bit of couth, I guess is the best way to talk about poop, with a little bit of couth. So, when you're asking them questions, just kind of do it matter of fact, everybody poops. I think actually that's the name of a children's book. But and just make sure you have that established rapport with them. Try and make them feel at ease and comfortable with you, and just kind of do it nonchalantly. If you come off as like, oh, well, can you tell me about how it is going to the bathroom? That's going to make them nervous. So just be, straightforward, matter of fact. This is information that I need to know. Make them feel comfortable, and hopefully you have established that rapport with them, and it makes it a little bit easier. And even if you are the PCP, the primary provider, and they see a GI specialist for their hepatitis or their Crohn's or pancreatitis or anything like that, you as their primary care provider still needs to ask these questions. Even though, GI is managing their pancreatitis meds and things like that, you still should ask them, how is your pancreatitis doing? Have you had any flare-ups? Or, how is your Crohn's? Have you had any flare-ups? How is your diet? Have you noticed any blood in your stool? Whatever it may be. So just also remember, as with anything, not just with GI, but even if you're managing a patient as their primary provider, but they see specialists, it's still your duty kind of as the gatekeeper to make sure that they're doing well overall. If they need, making sure that maybe they need to check in with their GI sooner than what they had planned because of what they have going on. So just kind of remembering to always keep closing the loop, making sure they're getting the care that they need, and just continue to establish that rapport with them. So that's my little sidebar. Hope it helped. As always, once again, if you have any questions, please let me know. Otherwise, keep doing a great job, and see you next week.